Member Calgary Fitz Creek.
Thank you, Mr. Speaker. Mr. Speaker, my questions are to the Premier. This government continues to make a mess of our healthcare system, and it continues to lose the trust of Albertans. Yesterday's Health Quality Council report shows that this government has its fingerprints all over deteriorating patient care when it comes to the EMS system. Despite recommendations, there still remains outstanding wait times throughout Alberta. Here in Edmonton, the response time continues to increase since 2009. That is precious time that can mean the difference between life and death. Yeah. So, how does this government have any actual plans to improve response times?
Honourable Minister of Health.
Well, thank you very much, Mr. Speaker. Obviously, the honourable member missed the substance of the news conference that was held yesterday, where the Health Quality Council presented a very clear roadmap to addressing many of the issues in ground ambulance. Mr. Speaker, as this House will know, in 2009, a previous government made a policy decision, which we support, to recognize the fact that EMS is part of health care and should be part of our provincial health care system. Mr. Speaker, it is true that there were some delays in consolidation of dispatch services in the province and some of the other very large-scale initiatives that are involved in creating a provincial EMS system. But, Mr. Speaker, this review provides a clear roadmap, and I provided clear direction to Alberta Health Services to implement these recommendations.
Honourable Member.
Thank you, Mr. Speaker. Given FOIT documents reveal that the amount of time ambulances in Edmonton who are on red alert have ballooned from a total of 3 hours in 2009 to 76 hours 4 years later, what is the government specifically going to make sure that patients don't suffer?
Honourable Minister.
Well, Mr. Speaker, the very dedicated doctors and nurses and other professionals that work in our system make sure, in fact, that patients' needs are addressed and addressed very well each and every day. Mr. Speaker, the honourable member should know that wait times in emergency departments are primarily a function of flow within the emergency department and the hospital generally, not a function of the EMS system. And Alberta Health Services made some very great strides in the last year in reducing occupancy rates in our hospitals, in eliminating much of the need for alternate level of care placements for people who are waiting for continuing care, and in many other initiatives that have greatly improved the flow within our system, at the same time as we see a huge growth in population and the number of visits consequentially to ER departments.
Honourable Member.
Mr. Speaker, given that this government seems to be having trouble understanding the impact of minutes in emergency care and the danger of leaving our first response teams in red alert, when will this government stop running out the clock and put the interest of patients first?
Well, Mr. Speaker, we most certainly do put the interests of patients first, and part of that involves looking at objective evidence, taking expert advice, and forming opinions and making decisions based on that, as opposed to hearsay and other measures that are intended, I can only see, to scare the public. Mr. Speaker, we have a very, very busy healthcare system in Alberta. It's a function of our economic prosperity. It's a function of the facts such as the numbers of Albertans, 100,000, I believe, last year, that came to this province. And it's also a function of our commitment to continue to invest in healthcare. Mr. Speaker, the issues that are discussed in the Health Quality Council report are issues that you would find in any major growing centre across the country. What's important is the action that we're taking to deal with those, and that, Mr. Speaker, is what Albertans can take.
Honourable Member